So as a pediatrician, I do strongly recommend getting your scheduled vaccines, and more importantly with this season your flu vaccines. Now that we are all dealing with this COVID-19 and the pandemic this year, it's more so important to get your child vaccinated and protected against the influenza, both being respiratory infections. There is no you are likely to get either or even both. COVID-19, as of now we don't have a way to prevent it, but for influenza flu we can prevent easily by just getting your yearly flu shot. So I strongly recommend that. uh, Generally, like in medicine, there is a saying, and I believe in strongly, is prevention is going to be always better than cure. Children are more prone to get infection, get infected from flu, because that they share everything, they play with the other kids. Now that we are going to be talking about opening school with this hybrid culture, some kids will be going to school, some will not, some will be doing the virtual learning, but they are prone to get the infection more than any adult, and they can spread the infection to their family members and others as well. So that is that's why it's more so important to get them protected with a flu vaccine, with just getting your flu shot. There are very minimal side effects with the flu vaccine. You can just get local tenderness and injection site soreness and maybe mild flu-like illness, but that should not prevent you from getting a flu vaccine. I do get that question a lot from many parents, that they can get flu regardless whether they are vaccinated or not. That is true, because how effective the vaccine is going to be, it's hard to tell unless we do the analysis at the end of the year. You can still catch a different strain of a flu virus, and you can get a mild illness from it. But if you are immune with the vaccine beforehand, then your disease is not going to be as serious as you were to otherwise. So getting your child vaccinated definitely prevents inpatient hospitalization, and maybe in some cases complications, like younger the kid, the risk is more that you are going to get more complication from the flu infection. You can get pneumonia, sometimes encephalitis, viral meningitis, and the sequelae from there. Luckily, we do have like antiviral treatment that we can use against flu, but it's not necessarily that you can prevent the complication if you are to receive the antiviral treatment. You can definitely decrease the infectivity, and also maybe the disease will be milder compared to you not taking medicine, but the long-term consequences and hospitalization and even death cannot be prevented by antiviral medications. Last year, for example, CDC reported there are like 187 deaths from just influenza. So influenza is a deadly disease, just like the COVID-19. So we can prevent it with just yearly flu shot. I strongly recommend that to all my parents and my patients who are the kids.